If you're confused about what specialty of nursing you want to go for, whether you're newly licensed or you're transitioning as an internationally educated nurse, choosing a specialty can be overwhelming, but at the same time, it is empowering. Here are some specialties to consider that offer growth and learning. One is the medical surgical nurse, MedSurg. It's a great starting point. You will care for patients with a variety of conditions, build time management skills, and strengthen your clinical foundation. It is also perfect for skill building, resume boosting, and transitioning into another specialty. The ERO nurse, emergency room nurse. It is a fast-paced, high-pressure, and unpredictable. You will triage and treat patients in life-threatening situations, from trauma patients to stroke patients, and note that no 2 days are the same. It is great for quick thinkers, adrenaline lovers, people who want to work in a fast-paced environment, and problem solvers. The skills you will gain in this is triage, crisis management, and prioritization. Another one you should look into is the intensive care unit, ICU nurse. This is critical thinking, and critical thinking meets with compassionate care. You will care for critically ill patients who require constant monitoring, often using advanced technology and life support. And this is great for someone who is detailed oriented and who thrive under pressure. The skills you will gain in this is ventilator care, hemodynamic monitoring, complex assessments. We have the pediatric nurse. Pediatric nurse is you're caring for infants, children, and teens. And note that you will also support not just the patient, but the entire family, offering education, comfort, and playful encouragement. And this is great for patients, nurturing, and energetic nurses. What we gain here is growth, development, knowledge, and family-centered care. Operating room nurse, or the periop nurse or perioperative nurse, surgical support and precision. You assist during surgeries, prepare patients, and ensure sterile technique. It is collaborative role that requires focus and calmness. It's great for any nurse who is detail-driven, organized nurses who love structure, and you will gain aseptic technique, surgical procedures, and there is a lot of teamwork. Step-down nurse, or they call it progressive care unit. It is a bridge between ICU and other units, ICU and the general wards. Patients are stable, but they still require close monitoring. You will manage complex patients without the full intensity of ICU. It is great for nurses looking for a balance between acute and medical surgical. It is the skills you will gain here is cardiac monitoring, complex medication administration, and geriatric nursing. This is dignified care for aging adults. You will manage chronic illnesses like dementia, mobility issues, and you will provide emotional support to the clients and the families. It is great for empathetic, patient, and attentive-driven nurse. The skill here you will gain is dementia care, mobility support, chronic disease management. If there's any other nursing specialty I'm missing, kindly put that in the comment section. You don't have to start in your forever specialty. Every step is part of your growth. Start where you can learn, then you evolve into where you can shine. Have a great day.